ECDC On Air,
the podcast of the European Centre for Disease Prevention and Control.
Keeping up to date with European epidemiology.
Hello and welcome to ECDC On Air. I'm your host Nicholas, and today we're going to talk about how wastewater can be used to monitor infectious diseases. I'm joined here in the studio by two experts from ECDC who will help us understand how this works, how this method has developed, and how it can make a difference for Europe's health preparedness. Here in the studio we have two experts from ECDC. We have Theresa, we have Max. You're both microbiologists. So I want to dive in a little bit and look a little bit more closer on the topic. But before we do that, it would be interesting just to hear, how did you get into this field from the start? Was there any particular moment, outbreak, or any research question that made you interested?
I think it all started a little bit with the pandemic. We are both working a lot with SARS-CoV-2 during the pandemic, as everyone else as well. And wastewater became really a big thing in that time. It was used to monitor the variants and infections and the prevalence of SARS-CoV-2, and a lot of investments were made at that time into wastewater surveillance, and I think this is how it started a little bit. Would you agree, Max?
Yeah, absolutely. So wastewater is not a new tool. It has been around for a very long time. Poliovirus has been surveilled in environmental surveillance for quite a long time. But as Theresa said, in the beginning of the pandemic for COVID-19, wastewater has become a tool that was explored a lot more.
Maybe we should start off a little bit with explaining the concept to the listeners who might not have really gotten familiar with this concept before. When we talk about wastewater surveillance, how does it work in practice? Do you send off a team to go down to the sewers to collect samples that then get sent off to the labs? Where is it being done and how?
When we talk about wastewater surveillance, we usually refer really to testing wastewater, as you say, somewhere it needs to get sampled, and then extracting data from that, generating data that can be used for surveillance activities. And then we also talk about wastewater-based surveillance, so using that data for surveillance of infectious diseases. And when we say wastewater, what we mean is usually the water that comes from municipalities, from domestic and non-domestic sources. So that can be houses, nursing homes, schools, but sometimes even a little bit of industry or medical facilities like hospitals. So this water enters the sewage system. And again, that can be sewage, but also grey water. So from the shower, from the toilet, from the sink, altogether. That enters the sewage system, and usually you take samples at the entry point of the wastewater treatment plants, so before the wastewater gets treated. So you have most of the bacteria and viruses still preserved in the sample, and you can actually measure that something. But you could also go upstream, as we say, and get closer to the points of where the sewage enters the sewage system, if you want to sample at specific locations.
Is this, you mentioned before, this is not really quite a new method. It's been existing for quite a while. Can you maybe walk us through a little bit, how has wastewater surveillance evolved over time?
Yeah, I think it's a super interesting question, Niklas. And I think it mostly started from our perspective today with the poliovirus environmental surveillance. It's a program that has been run for several decades now. WHO has long-standing experience and has issued guidances on how to do this environmental sampling globally. There's a global laboratory network in this regard implemented as well. And so this sampling is termed environmental sampling because it's not only focused on sewage systems. When we in Europe talk about wastewater surveillance, we focus largely on sewage systems. But you could also talk about unsewage systems, where you have little canals where water flows without it being enclosed in concrete pipes or something like this, right? So these unsewed areas could also be rural, remote areas where you want to take samples. So wastewater surveillance has evolved in that sense for a lot of different settings and has been adopted for different purposes. And using it for pathogens other than poliovirus is not a new idea, but it has been sort of a little bit forgotten over the time. Other surveillance systems were a lot more easy to use and implement, apparently. And we need the clinical surveillance systems that we have established today for a lot of purposes that wastewater surveillance, not all, can't address all of them. So we do need these additional systems. And now, as we mentioned earlier, with the COVID pandemic, the wastewater surveillance was a very attractive tool to get population level data with relatively fairly smaller investments.
Can you sample wastewater for any pathogen?
The idea is, of course, that the pathogen or the virus, bacterium, or anything, a parasite even, needs to be shed from the human body in one way or another. As I mentioned, in the sewage, we collect from waters that are coming from the toilet, but also shower and sink. So when you brush your teeth, when you use the toilet, when you shower, somehow the pathogen needs to enter the sewage and also needs to sort of survive the time that it needs from the household to the treatment plant. So there are some factors that definitely affect how well a pathogen can be detected. How resistant is it to being exposed to air, to all detergents, soaps that are in the water, whatnot. But technically, all pathogens could be detected that are shed from the human body into the system and can survive that stress in the environment.
So it feels like everybody's talking about wastewater surveillance these days. Is it kind of like the holy grail of surveillance?
Yeah, indeed, it became more and more famous, and more focus was on wastewater. However, we think it's more like a complement to the regular surveillance systems and should not stand alone. It has some advantages. It has also some disadvantages. It depends a little bit on the pathogen. As Max just said, you can detect mainly the pathogens which are actually shed into the wastewater. So it's not the holy grail. It's not a solution to everyone, and we don't think it will replace any regular surveillance. But it's a very useful tool to complement the regular surveillance.
Do you think that there is a tendency to overstate the importance of wastewater surveillance?
I think there were a lot of investments made into wastewater surveillance, but we have to consider it carefully if it really makes sense. What can you get out of it?
I would maybe add as well to what Theresa just explained, that what we need to do is, and it's a bit connected, Niklas, to your previous questions, what we need to be able to detect something. So when we at ECDC, when we look at, we want to recommend, for example, a specific virus or bacterium for wastewater surveillance, we would need to look into what is technically feasible. So the analytical and technical feasibility of being able to detect it, and does it make sense, the data that we get out of this? Is it correlated somehow to actually the prevalence of a disease, the spread of a disease? Does it correlate to the cases that we identify by the traditional surveillance systems as well?
Mm. So they really, the different systems really complement each other then. If we look at the reliability of wastewater surveillance, I understand that from wastewater surveillance, you can check if there is within a geographical area where there is actually a pathogen present, but you can't count any case numbers like you can if you do surveillance in hospitals and so on. Is that the main difference? And also like the reliability of this? Maybe you could expand a little bit more. Can we be sure that the samples say the right thing?
As you just said, so you can't detect any specific cases or any single cases, but you can detect the presence or the absence of a pathogen, but you can also detect trends. So you can see if, for example, SARS-CoV-2, if there's an increase in cases, then you would see an increase of SARS-CoV-2 particles or viruses in wastewater as well. And here one advantage of wastewater surveillance is that you can also detect asymptomatic cases. So usually clinical surveillance catches only symptomatic cases. When you go to the doctor, you get tested, and this is getting reported. But asymptomatic cases usually don't get reported. So this is one advantage of the wastewater surveillance as well.
And I guess that's it's useful as well because many people don't actually go and get tested.
Exactly. Especially recently, not everyone is getting tested for SARS-CoV-2 anymore. But it's still important, of course, to monitor the trend.
In terms of acting like an early warning system, how important do you think it is for that purpose?
So it can be very different by different pathogens. Now you take the example of SARS-CoV-2, so COVID-19 as a disease, right? And here we have seen a little bit of a changing picture over the pandemic. Early in the pandemic, a few people showed that there is a little bit of an opportunity, a time window, where you see an earlier increase in the signal in the wastewater compared to cases being detected, or even a larger window compared to hospitalizations being detected. Now that window has been shown to be different with different variants of SARS-CoV-2 that have been circulating. And today this early warning window, if you will, has been a lot smaller than it was at the beginning of the pandemic. So the early warning character of wastewater for SARS-CoV-2, for example, could lie rather in the detection of a new variant that is known from another part of the world, for example. And then you would be able to detect it probably first in the wastewater when it enters into a new country before you see it in clinical cases, a new SARS-CoV-2 variant.
Mm-hmm. And how long does it actually take, the whole process, from detecting the signal to actually taking public health action?
It's a very good question.
Yeah, and I believe this is also related to the trust that our public health officials and epidemiologists, microbiologists, but also all the decision makers have in the data that is generated. And here from ECDC side, one of our key concerns is, of course, that we want to harmonize methodologies in Europe, both on the laboratory side, but also on the data analysis side, to be able to trust the data that is being generated, so you can actually base decisions of that data that you produce. And still, you would never base probably a decision solely on one data source. You would integrate the data sources that you have and make a combined picture of the situation, and then you may take a decision. But from the sampling to the data, it can be just a day or a few days to generate the data. And it depends, of course, how often you then sample. During the pandemic, some countries did up to, I think, 3 times per week, which is a lot of data points. And then the data you generate is trustworthy, and you can easily follow a trend. If you then go down and sample maybe every other week or every month, then your data points become a lot more spread out. Yeah, and it's more difficult to act upon one single data point.
Mm-hmm. So quite recently, we've seen in Europe some detections of both vaccine-derived poliovirus and wild poliovirus. Theresa, have you been involved with this in ECDC and in monitoring this?
Yeah, we were informed by the authorities as well. So one of the detections of wild poliovirus was in Germany, in Hamburg.
Can you explain to the listeners who might not understand the difference between wild poliovirus and vaccine-derived poliovirus? What's the difference there?
Can start if you want.
Yeah, you start.
When you talk about wild poliovirus, there were 3 types, and currently it's mostly wild poliovirus type 1 that is circulating in very few countries globally. So mostly Afghanistan and Pakistan, actually. But it can be, a person can be infected, doesn't have any symptoms, can travel and shed it somewhere else as well. And vaccine-derived poliovirus, as the word says, is a virus that is derived from a live attenuated vaccine. So that is a vaccine where you use not parts only of the virus or a dead virus, but it's a living virus, but it is attenuated. It is tuned down that it doesn't cause disease. So that is the oral polio vaccine, several different ones. And when they circulate in a community for a prolonged time, they can acquire, again, a phenotype, a representation that can cause symptoms. And those are then called vaccine-derived polioviruses.
But both these types, they can be detected through wastewater surveillance. Is it, when we had these detections in European countries, they reported them to ECDC. What did ECDC do with that data?
So in the end of 2024, beginning of 2025, there was vaccine-derived poliovirus detected, type 2, was detected in several different cities in Europe. And then ECDC's role is, like we do for other disease outbreaks, of international relevance as well, to bring together the public health actors of the different states, discuss the situation that is happening, but also produce a risk assessment of the situation. That is what ECDC did back then.
It seems to be that this has almost the longest history when it comes to wastewater surveillance. Is that because it's particularly easy to detect poliovirus in the water?
The virus itself is relatively robust and can survive in the environment, so that's probably why it is easier to detect as well in the laboratory than in the samples. But the case is also that poliovirus causes symptoms in humans only in about 1 in 200 individuals if they're unvaccinated. If they're vaccinated, it's a lot less even, right? So the chance, if you will, to detect a person that is symptomatic of poliovirus infection is very small. So surveillance in the environment for the virus it's a lot easier to pick up any signal.
So this brings me a little bit more to the ethics side of wastewater sampling. I mean, is it possible to pinpoint exactly who has been infected with this method? And I'm thinking particularly about diseases that might be a little bit sensitive. For example, last year we saw detections in Hamburg of wild poliovirus. Would it be possible with this method to actually say who was the person who had it?
I don't think it's possible to pinpoint the source to one specific person. But there are considerations because the human DNA is also shed into the wastewater as well. So in theory, you could look at this, but of course, this would be unethical. Another ethical concern is as well that detections of some diseases which are a little bit sensitive might lead to stigmatizations of certain subgroups or smaller populations. So there are definitely considerations into these ethical aspects.
And would you say there is robust mechanisms to prevent that states move across what the ethical limits are?
I think there is still a need to set up these regulations. I don't think we have sufficient regulations yet, but it's definitely something that needs to be considered and set up international, maybe even in the future.
When you do detect a case, in the case of polio, for example, what's being done then? What's being done with the data? Can it guide public health action?
Absolutely. So public health action is usually what we are aiming at, right? We create data for action. We want to create data and get it in a timely fashion to implement any public health measure to prevent disease and keep our populations healthy. So for poliovirus, a vaccine exists, which is then the most upon called intervention to see, are there immunization gaps in the population? Can we do any catch-up vaccinations of maybe people that missed vaccinations in the childhood? So that is one intervention that is usually done.
I wanted to understand a bit more in terms of the implementation of this method across Europe. Is it even, have all countries started to use this and also for which pathogens? Can you give us a little bit of a picture?
I don't think it's implemented in all European countries yet, but it's the numbers of countries are increasing who are doing wastewater-based surveillance, and currently the main focus is on SARS-CoV-2 because this was very famous in the pandemic, as I mentioned before, and very prominent, but other pathogens that are monitored are other respiratory viruses, for example, influenza virus, but also RSV. I think these are the three main targets here in Europe and which we are also interested in. In some countries, they are monitoring as well enteroviruses, non-polio enteroviruses. I think these are the main targets for now.
Mm-hmm. But it's still a bit of an uneven picture across Europe.
Yes.
What do you think is holding countries back then? Is it funding? Is it lab capacity? Lack of political will? Or
So during the COVID pandemic, the European Commission provided a lot of funding and initiatives to promote wastewater-based surveillance and use of wastewater surveillance in public health. And here we had a lot of actions that were implemented by HERA, which is the Health Emergency Preparedness and Response Authority. And they work closely together with the European Commission's Joint Research Center and together also with the Director General for the Environment of the European Commission. A lot of different funding opportunities were provided to the member states to implement wastewater-based surveillance. And the primary target back then was SARS-CoV-2, naturally. And as Theresa said, other respiratory viruses were then on the horizon for a lot of member states. So it's influenza and RSV that are implemented in many countries. But then we have a very large different landscape of implementation. Some countries were also looking into, for example, detecting measles virus or mpox virus in either parts of the country or also for specific periods, so not continuously.
Let's talk a bit more about ECDC's role specifically. I understand ECDC has published a framework now on wastewater surveillance. I think there's recommendations on forming like a network for experts on this in Europe. Can you talk a little bit more about what does this actually mean in practice?
Yes, so there are several initiatives in Europe already ongoing. Max mentioned a few of them. So maybe we should also mention the EU WISH consortium here. The EU WISH consortium consists of 34 institutions in 25 European countries. And some of the work they are doing is on method harmonization, like harmonize the methods for wastewater detections across Europe, but also they are working on prioritizing certain targets for wastewater surveillance and so on. And ECDC is planning to build a little bit on this existing work by establishing a network for wastewater surveillance with our member states and our stakeholders. Then we have also in mind to set up, for example, an advisory group or something like that, which then can also advise on prioritization of targets for wastewater surveillance, which are interested for us or for ECDC's work and things like that.
It would also include providing some sort of laboratory support to further develop the methodology, but also implementation, so capacity building, like training is included there as well. And that is in line with how ECDC usually works with the member states. So networks are nothing new for ECDC. That's something that we have for all kinds of diseases. We gather the experts in the EU member states, EUA member states, in these networks, which form also basis for collaboration and discussion. So it's a lot about exchange of best practices as well.
I think we're moving towards the end of the interview. I only have one question left, and I want to take a little bit of a look into the future. What, in your opinion, would you see as the kind of future of wastewater monitoring? Are there any new technologies in the pipeline, or perhaps with AI or something like that you see that this will further evolve? And what do you see for the future?
I think that's a very interesting question, Niklas. And it's not easy to look into the future, but there are some ideas around, of course. So today, many assays, many laboratory methods that are used to detect a pathogen are very targeted. You need to know what you're looking for. So the concept of metagenomics is something that becomes more and more popular also in the wastewater surveillance field. So it means that you look into a sample and you use sequencing a lot to generate a picture of what all the pathogens, all the viruses, bacteria, parasites, whatnot, is present in your sample. So this is a concept that has been used for also in the clinical picture for individual patients, but it is also being applied for wastewater samples now. And these are very large data packages that are generated, and here probably AI and some sort machine learning maybe could be very well applied to make sense of the data that you create.
Yeah, maybe I can add here. So Max mentioned before when we talked about SARS-CoV-2 and the variants, so you can detect only variants in wastewater which are already known. So maybe in the future, using metagenomics or other approaches, depending on how the methods evolve, And maybe it would be even possible to detect pathogens which are not known yet, pathogen X, for example. So
Yeah, I mean, there's a lot of talk about disease X.
exactly.
And what would be the next pandemic? I mean, could we expect that wastewater surveillance might play a much bigger part then?
I think we are not there yet to detect disease X or pathogen X. But who knows what the future
But
will
at
bring.
least it could be one of the tools in the toolbox when trying to manage whatever comes next.
Definitely, as soon as we know what is coming next, it can definitely support and help the regular surveillance as well. Yeah.
That's all the questions that I have for today. So thanks a lot for being here on the ECDC On Air.
Thanks for having us.
That's all for this episode of ECDC On Air. If you liked it, please consider sharing it and giving it a review. We'd also like to hear from you about what topics we should be exploring next. Thank you for watching.